In Alberta right now, if you're having partners outside of a mutually monogamous relationship, you're potentially at risk of getting syphilis.
Alberta is currently in a syphilis epidemic. That's according to an infectious disease expert at the University of Calgary, who says the sexually transmitted infection has reached its highest levels last seen in the 1940s. In 2020, there were more than 2,500 cases of syphilis reported, an increase of more than 200 over the previous year. In the first quarter of this year, more than 750 cases were reported. Without treatment, the infection can cause damages to the internal organs, such as the heart and brain, and can lead to death. Infectious disease specialist Amita Singh says social media and technology is fueling the syphilis epidemic.
A big reason is the increased use of social media or dating apps. Because that makes it a lot easier to arrange casual and anonymous sexual contact.
Singh says the rise in methamphetamines is another contributor.
And a disproportionate number of those cases is among Indigenous persons. And many of the cases are also disproportionately affected by a number of what we call the social determinants of health. So homelessness, poverty, addictions, mental health issues.
Alberta's top doctor had mentioned the disease in her latest op-ed in defense of why the province had decided to drop the health measures, saying the majority of our public health resources have been directed at the COVID-19 response. That has come at the cost of not fully working on other threats like syphilis and opioid deaths. In the short term, Singh projects a rise in cases, saying there will likely be an uptick in testing as more people start to access services again. Alberta Health tells us planning is underway for activities and communication initiatives that target specific populations and local areas that have the highest rates of syphilis. In Edmonton, Rochelle Sufi, City News.